Perform your initial steps. Refer to the medical record and identify your patient and verify allergies. For this procedure, you'll need your primary IV tubing, secondary tubing if needed, normal saline flushes, and alcohol pads. Carefully open the IV tubing bag and inspect your tubing to make sure there are no holes or defects. Remove any papers holding the loops in place. Remove the cover from the spike of the bag and also pull down on the cover of the bag mouth. Hold the mouth of the bag with your non-dominant hand and spike the fluids with your dominant hand. Prime your drip chamber about halfway full and then open the clamp. If using a cassette-based tubing, be sure to invert the cassette upside down so the first chamber in the cassette can fill with fluid, then turn it right side up and it will continue priming. Prime to the very end of the IV tubing, making sure that all bubbles have escaped. If using a cassette, you may now insert the cassette in your IV pump and close the door. Keeping the IV tubing capped, place it near your patient. In this case, we are using a secondary tubing as well, so we will carefully open it in the same manner and inspect the tubing for holes or defects. Again, remove the covers from both the bag and the spike and aseptically spike the bag in the same manner that you spiked your primary bag. Ensure that the roller clamp is closed and then prime your drip chamber again halfway full. Then open your roller clamp and carefully prime the tubing, keeping in mind that it is a much quicker process for secondary tubing. Cleanse the port adapter on your cassette per facility policy. Remove the cap from your secondary tubing and twist it into place, ensuring a secure connection. Then open the roller clamp. Don clean gloves and flush your IV site per facility policy. Every time you flush, be sure to expel the air bubble at the top of the syringe. When flushing, pull back to ensure you still have adequate blood return, and then flush accordingly. Cleanse the port on your saline lock again. Remove the cap from your primary IV tubing and securely connect it to the patient's normal saline lock. You may then program your pump accordingly and infuse the infusion as ordered. Be sure to consider your IV fluids and your secondary IV medication as medications, and those will be properly documented on the patient's MAR.